dentistry has so many aspects to it. So once the caries has become so deep that it offends the blood supply in the tooth, the patient then needs a root canal. Those teeth have to be diagnosed. Sometimes they are diagnosed as necrotic, irreversible pulpitis. And when they are in this state, the only way you can survive or maintain that tooth in the mouth, you have to clean it of all the infection. And so the root canal involves removing all the decay, cleaning the canals in the chamber, and then you seal the tooth with a man-made material so that bacteria cannot re-enter the tooth. Sometimes the decay of the tooth is so badly that more than a third of the tooth is missing. And in that case, we do what we call post and core. And that means we clean out some of the gutta percha or the man-made material that we fill the root of the tooth so that we will have a post to build a core around to give more strength to the crown that we're going to place on the tooth. So endodontics is a last resort before taking a tooth out. And some people just don't want to take their teeth out anymore. So they have that option of having root canal done.